So first I would like to ask for your permission to use this video, which is a follow-up video for education and publishing on internet.
Sure.
Now, you have a quite significant osteoporosis, and we went through multiple surgeries after some compression fracture. When did we start doing these surgeries for you?
6 years ago
6 years ago.
was the lumbar surgery.
The lumbar surgery, and you had a broken bone, correct?
Yes.
Did it happen after a fall or anything like that, or did it happen just like that?
No.
So it was a spontaneous osteoporotic fracture.
Correct.
We treated that, and how was the result at first?
Oh, excellent. I had a good recovery, and I was back to my normal, you know.
But then we had the same problem in levels above, not where we did the surgery, but above there.
Correct.
And we repeated that process few times. Is that correct?
Yes.
When was the last surgery that we did put new screws in?
I think it's 3 years this month.
3 years this month. And in the last 3 years this month, we have been following you up with your clinical symptoms. How have been after the last surgery? How have you been clinically?
Clinically, I think I've done very, very well. Again, I had good recovery. I have a little bit. I'm a little limited by a kyphosis and my ability to reach without pain. But my activity of daily life is really unchanged.
Acceptable.
I don't do heavy lifting, but I take care of my house.
Okay. Now, for that reason, we actually decided, even though the films look like that you had another fracture in T4 and you have a kyphotic deformity, because your symptoms were so little, we decided cautiously just observe you. As you see here, you have practically everywhere from T5 to S1 fused, and bone is growing pretty good actually in every level. That multiple compression fracture that has been treated, and you have instrumentation. Additionally, you have the scoliosis. And at first, I was a little concerned about this level, the broken bone and kyphotic deformity. But because you had so little symptoms, we said we are going to watch it. And as I told you, this is a reasonable surgery to do. And I would give you that option, but I want to treat you rather than the pictures. And at this point, I understand that, you can go and do your basic daily activity.
Yes.
So for that reason, I wouldn't put my mother through this procedure. And I told you that, I think it's even though it's reasonable to do the surgery, it's as well reasonable to just watch you conservatively and manage you conservatively. Now, but again, obviously you have some concern that if you get older, your bone become weaker. That may become a more difficult surgery. But it's as well possible that the bone become like a block of bone there. That we never need to do that kind of surgery. So I think we still should just very carefully observe it.
I agree.
Obviously, you are at the risk, like anybody else who has osteoporosis, that if you fall and have an accident, the bone may break and so on. But at this time, I think if you are happy with your basic daily activity, it seems that the bone in this region is actually growing together in the back.
Good.
So I think it's reasonable here, especially here. So I think it's reasonable to just watch it. Do you have any question regarding this?
I do just want to say that I have very good internal medicine as my primary physician, and she and I have worked very closely on pain management since my very first surgery. Excellent. And I think that is a big part of how I've been able to
manage
do well.
That.
Yes.
Yeah.
And that's important as a patient.
I think it's very important.
Yes.
Absolutely. Thank you for the interview.